much. Okay. Good. Not seeing a lot of patients, but I do see one that needs a little extra care today. Let's pull up their chart real quick so I can make sure. Seems like they have case of pink eye, blurred vision, and some unknown symptoms. Okay. Just give me a starting point. Birthday for 30. 95. Okay. Right. Okay, perfect. Alright. Everything is keyed in. Alright. Let's call him back. Let's take a deep breath before we call our patients back. Today's gonna be a great day. Today's gonna be a great day. Alright. Devin, welcome in. So you can have a seat in the big chair there. I will be assisting you with your eye exam today. Could you confirm your date of birth for me? 4:30. Good. Thank you. So is this your very first eye exam? Okay, you had one when you were a lot younger. It was like a school pediatric type of eye exam. Okay. Good. Are you a smoker, drinker? Oh, that's good. Alright, do you have any family history of diabetes, macular degeneration, anything of that sort? Okay, good, thank you. Are you taking any medications? Okay. Okay, like some vitamins. Yeah, it's over the counter. Alright. And anxiety medicine as well. Okay. So what was the milligrams for that? Okay, 10 milligrams. As is. Okay. Great, thank you. So what brings you in for your visit today? Okay. So you woke up in the middle of the night. Alright. Yes. So your eyes were closed shut due to crust in the eye. Was that both or just your left or right? Okay, both. Did you take any eye drops or warm compressions or anything like that? Just warm compressions, okay. Because the eye drops did not work. Alright. And what eye drops did you use? Sustain, okay. Any pain or discomfort? Okay, both. Okay. Yeah, no worries. Since this is your first exam, we want to make sure that everything and anything that's going on with your vision today, that we, get things under wraps. So it's best that you came in now just go in and I'll do a few tests on your vision just so we can make sure that there's not anything going on behind the eye. We just want to make sure that you are A-okay, and we'll leave, with more of a knowing of what's going on with your vision today. How's that sound? Okay, yeah, so please ignore my girls. I need to eat me something. I haven't eaten anything, but that's okay. As soon as I'm finished up here, I'm gonna eat me a good old burger properly. But anyways, let's go ahead and get started. Yeah, so I'm gonna wash my hands and then we're just gonna go ahead and get started. Let's make sure my hands are very thorough and clean before we get started. And just take deep breaths along the way. Nothing here is going to hurt you, but for any reason that it does, just please let me know, okay? And I will stop and allow you to get your bearings before we start with the next eye exam portion, okay? So I'm gonna put on my gloves here. And we're gonna go ahead and get started with your exam. Alright, so we're gonna start off with a vision check, okay? Right, so I'm gonna cover your eye. Are you able to read row 1? Good. What about row 3? Good. And last but not least, row 5. Awesome. Alright, we're gonna just change eyes here. So, can you read row 1? Good. What about row 3? It's a little fuzzy. Okay, and row 5. Alright. Thank you. Alright, I'm just gonna note that real quick. So it seems that your left eye is a little bit blurry than your right eye. So we're gonna do a couple more exams. None of these hurt, but I do have to get up close and personal. You okay with that? Okay, so pretty much what this entails is I'm gonna get a little bit close to both of your eyes just so I can get a full in-depth of what's going on. I'm gonna reach in, I'm gonna open your lids, and I'm gonna start doing plucking. And I'm gonna pluck whatever it is that I see from both eyes, okay? Alright, I just wanted to give you a little bit of rundown before I get started and to ensure that you know what's going on. Alright, you ready? Okay, breathe in. Good, and exhale out. Good, alright, so I'm gonna start with your left eye. So, I'm just gonna come a little bit closer. Open your eye just a little bit. Good. And I'm just going to use some eye tweezers just to pluck a few things from out of here. Pluck, 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 pluck. We're almost there. Okay, you can blink. Good. Blink. Good. Alright, I'm gonna come back in, okay? Is that alright? Okay, here we go. Pluck. Some things are a little bit more tougher than the other, into the system real quick. Yeah, so you'll more than likely get a final prescription towards the end. And this is just to give you a slight correction, and that's a good thing with coming into an eye exam, because you think that you might be coming in here for one thing, and it may because of due to another symptom. And so it looks as if you may need prescription glasses towards the end. Again, I have a few more tests to do on you before I make that final decision. And so you have also been experiencing headaches, okay? And I'll jot that down because sometimes that is the reason you're squinting and you're trying to focus a little bit more, and one eye is compensating for the other. So, like I said, I have a couple of more tests to do, and then we'll do a confirmation towards the end. And if a prescription is needed for you, then I'll fill that for you. So yes. So let me go ahead and put that down. You said that you were experiencing headaches and things like that as well. Okay, I want to make sure that I do that. Okay. So we're gonna go ahead and get started with your other eye, and it's the same concept. I'll open your eye a little bit, and we'll start plucking and things like that, and I'll let you rest. Okay. All right. So let me know when. Okay, ready? Okay. All right. So just breathe. Okay. Okay. All right. And I'll be super quick. Okay. All right. Just opening your eye just a little bit more there. Okay. Pluck, 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 pluck. All right, you can close your eyes for a second. Good. Yeah, it's not so bad, huh? Yeah, it's not so bad, huh? All right, we're gonna go ahead and get started again. There you go. I'm gonna lift your lid up just a little bit more. There we go. Pluck, 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 pluck. All right, you can blink, 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 blink. Good, 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 good, good. All right, one last time. Here we go. Okay, pluck, 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 pluck. Yeah, I have to do this eye a little bit more in depth, okay? Okay, we're gonna do it one more time. Blink, 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 blink. Good, 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 good. One more time. Pluck, 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 pluck. All right, you can blink. You can blink, 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 blink. Okay, good. So this next round, I'm just going to do a couple of measurements of your pupil. So yes, glasses and or contacts are needed. Which one would you prefer? Yes, starting out, we'll do glasses. And if you would like to transition to contact lenses, then we can go through that process, okay? All right, so I'm just gonna measure your pupils really quickly, just the distance. This is just gonna take just a few seconds, okay? I'm just gonna use this measuring stick just for that, okay? All right, so just look straight ahead. Try not to blink. Blink, blink. Okay. Okay. Good. Thank you. Now center. Good, 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 good. Just gonna do a fast pulse, okay? Just to check your pulse here. Good, 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 good. Good, good, good. And light perception is great. Good, 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 good. Good, good. How about when I bring it here? Can you still see it? Good, good, good. How about here? Good, good, good. Look up for me. Good, 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 good. And look down. Good, 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 good. Good, 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 good. Good, 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 good. All right. And just follow the light for me. Good, 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 good. Keep following. Again. Up. Awesome. Muscles are great. So your eye muscles are great. Okay. So I'm gonna put a couple of eye drops in your eye. Just to ensure that you can feel a whole lot better, okay? They may sting or burn, so just keep your eyes closed after I give you these drops, okay? Alright, we're gonna do some jumps, so do one here. Okay, we'll do another one here. Alright. Does that feel good? Yeah, I figured it would after everything that we've done today, and thank you so much for your participation. So I'm gonna go ahead and finalize your eyeglass prescription, and it'll usually take 1 to 5 business days. But if you would like for us to send your glasses to your home directly, just let me know and I'll update your or confirm your address to ensure that we got the right address and everything in there, and then we'll send it out to you. You'll also receive a text message as well, so I'll confirm all of that once more just to ensure that that is right. So what is your address? Okay, that's correct. And your telephone number. Okay. And also with today's copay, would you be paying with card or cash? Okay, perfect. Thank you so much, Deborah, for confirming all of that. So I got your eyeglass prescription here, and you're going to see a huge difference once you get your glasses and put them on. I suggest all my patients to wear them for a couple of weeks, like literally wear them constantly for a couple of weeks, because sometimes, you know, for first time wearers, you may get nauseous, you may even experience headaches, but just think about it. It is a prescription, and with any medication, prescriptions and things like that, you have to ensure that you're taking the medication. So wear the medication so that way that your body can get adjusted to it, okay? That sound good? Okay, yeah, so think of it as this is my prescription, this is my medication, and it is very, very, very important to ensure that your vision, if not stays stable, it gets better over time, okay? Alright, let me go ahead and get that in, and then I'm going to plug this prescription in the system. Right eye. I know I'm going to be eating pretty soon, but my food craving can wait at this moment because my patients come first. I absolutely love taking care of my patients and ensuring that they get the best care. So, alright. Okay, so here's your final prescription. If for any reason you lose this, you can always come back in and we can print one out for you, and or your email, which, what is your email? Make sure to confirm that. Gmail.com. Okay, thank you so much. So here's your prescription. Alright, Devin, thank you so much for coming in today to your thorough eye exam. You can just stop at the receptionist desk, and if you want to schedule for another eye exam in the next 2 to 3 years, you can go ahead and schedule that. You'll also receive a confirmation text for that as well. But thank you so much for trusting me to take care of your vision, your eyes, so you can